So alcohol withdrawal syndrome is a spectrum of problems. It is the body's response to so when you drink, whenever we do anything really, we get kind of used to, there's sort of three things you can, if we do any behavior at all, it doesn't matter what it is, right? You can sort of have three responses to it. You can either have the same response every time you do it, right? You feel absolutely identical every time you do it, or you can have less response or more response, right? So with psychoactive drugs in general, repeated exposure, you get tolerance, meaning that has less and less response, right? With tolerance often becomes the opposite of that, is dependence. And that when you stop that drug, whatever it is, whether it's cigarettes, food, whatever you want to make it, right? You have a withdrawal syndrome. That's the opposite of the primary effect that the drug had on you, right? So if alcohol makes you feel relaxed, the alcohol withdrawal syndrome makes you feel stressed and irritable, okay? So at its mildest, alcohol withdrawal can happen in even healthy, normal drinkers. And it can be very mild. They might just feel edgy, irritable, maybe have some trouble, like falling asleep, right? So mild alcohol withdrawal is, just as it says, mild. With increasing, but depending on how much you're drinking and how tolerant you are and how dependent you are, the severity of alcohol withdrawal can increase. And it progresses through it affects several different types of systems. First, psychological effects. People can feel both more irritable, more anxious, more depressed. They can have sleep disturbances. They can have headaches. And those are all classic symptoms of alcohol cessation. There are physical symptoms, and these symptoms are mediated through the autonomic nervous system. And those are things like getting sweaty or clammy, having your heart racing or pounding, or getting a tremor, shakes or tremors. The tremors can be very fine. I'm showing some here, right? Like a fine tremor. They're usually not like a Parkinson tremor, which is like that, but they're generally fine tremors. And if you're developing fine tremors, like 8 hours or 10 hours after you're drinking, that's a sign that you're alcohol dependent and having an alcohol withdrawal syndrome. Sometimes people get GI symptoms of withdrawal. They get nausea, vomiting, diarrhea. So sometimes people will report that when they try to stop drinking, they get a lot of diarrhea, right? Vomiting while drinking is a separate problem, but like the day after, when there's, when you haven't had any alcohol for a while, right? And then you feel better after you drink, that's classic alcohol withdrawal, right? Now, that's all the mild to moderate alcohol withdrawal, but there can be severe alcohol withdrawal. Severe alcohol withdrawal is characterized by seizures, which is where abnormal electrical activity in the brain results in a loss of consciousness and involuntary motions and movements. And the danger there is people can get injured. As the seizure comes on, people can fall. They can be, if they're operating machinery or driving, they can get really, have a terrible outcome there. They can also have hallucinations, alcoholic hallucinations. So we say hallucinations. What do we sort of mean by that? Well, that sort of starts with in the earlier states, that starts with like sounds feeling odd, like too loud, harsh, irritable, lights looking too bright or irritable, right? And progressing to sometimes feelings of like things crawling on the skin or bugs under the skin, or seeing actually things that aren't actually there, like bugs crawling on the skin, or seeing or hearing things that aren't actually happening. And they can be quite scary, quite intrusive. So severe alcohol withdrawal syndrome is characterized by seizures, losses of consciousness, and these sensory and perceptual disturbances, right? That go all the way from just like odd sensations to frank hallucinations. So that's alcohol withdrawal syndrome. So there's something called delirium tremens, right? So people say, I got the DTs, but DTs are something different. DTs start, but no sooner than 72 hours after your last alcohol dose, and generally go around 4 days later, and they are life-threatening. So DTs are rare. They usually occur in the context of some other medical illness or problem. They're often seen in the hospital, and like patient hospitalized for like a heavy drinker. Let's say we have an 8 to 10 drink a day person develops pneumonia, and they have some mild alcohol withdrawal syndrome on presentation, but in day 4, their blood pressure and their heart rate really climb up. They become severely confused and agitated, right? And that patient needs oftentimes ICU management and massive doses of sedative drugs to get them through. And without and because there's almost always happens on a background of some other medical catastrophe, right? There's a high mortality in those situations. So when people say they have DTs, they're usually actually talking about like the tremor that comes with alcohol withdrawal in mild and moderate cases, right? They're not talking about this life-threatening, admit to hospital situation. So it's not the little tremor that's DTs. DTs is unstable vital signs and severe confusion. So that's sort of the stages of alcohol withdrawal. Can a patient who has mild alcohol withdrawal eventually develop DTs? Absolutely, right? I mean, again, if you have something else going on, let's say you have appendicitis and you're a heavy drinker, right? Or you have a gastrointestinal bleed and you're now in the hospital, like on IVs. At day 4, you can get really sick, right? And that can sometimes be missed. And it's an important, I think one lesson here, if you're a normal person, is to, like if you have a drinking problem, tell your doctors about it if you go to the hospital. Say, look, man, I do drink 6 to 10 drinks a day. And, and when I stop, I don't usually get too sick, but just letting you know, right? It'd be smart if it doesn't help you to not tell the truth here.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.